Sinus of Morgagni. The sinus of Morgagni is a defect in the anterior aspect of the pharyngobasilar fascia. It transmits the eustachian tube and tensor vela palatini muscle, allowing communication between the nasopharynx and middlea. This should not be confused with Morgagni's sinus, which is the ventricle of the larynx. That is the sinus of Morgagni, this space between the upper border of the superior constrictor and the skull base. The sinus of Morgagni. It is a space between the skull and the superior constrictor, and through it enters the eustachian tube, the tensor velae palatini, and the ascending palatine artery. I repeat, through the sinus of Morgagni enters the eustachian tube, tensor velae palatini, ascending palatine artery. It is a gap created by indentation of the superior constrictor. The gap is bridged only by the pharyngobasilar fascia. Tumors can easily breach this area and spread into the parapharyngeal space. This is the sinus of Morgagni between the skull base and the superior constrictor, and through it traverses the auditory tube, the levator tensor palatini. Let us have a mnemonic of structures passing through the sinus of Morgagni. ATM, standing for ascending palatine artery, the auditory tube, and the levator palatini muscle. I repeat, the mnemonic for structures passing through: ATM, ascending palatine artery, the auditory tube, T, M, levator palatini muscle. Ascending palatine artery, A, T, auditory tube, M, levator palatini muscle. And this is the sinus of Morgagni. Advanced nasopharyngeal carcinoma can extend into the middlea via the sinus of Morgagni. Malignant invasion of the sinus can result in Trotter's syndrome. Trotter syndrome relates to advanced nasopharyngeal carcinoma and is the constellation of unilateral conductive hearing loss due to middlear effusion, trigeminal neuralgia due to perineural spread, soft palate immobility, the Trotter syndrome. The sinus of Morgagni is a gap in the upper margin of the pharyngobasilar fascia located in the posterolateral part of the nasopharynx. The pharyngobasilar fascia, also called the pharyngeal aponeurosis, is a fibrous layer which lines the internal surface of the muscles of the pharynx and is particularly thick in the upper part between the superior constrictor and the skull base. I repeat again, what are the structures passing through the sinus of Morgagni? We have the mnemonic ATM, A standing for the ascending palatine artery, T the eustachian tube, M the levator velae palatini muscle. The clinical importance of sinus of Morgagni is it provides a pathway of least resistance for spread of tumors from the nasopharynx to the lateral skull base. Neoplastic infiltration of this region called the Trotter syndrome can result in ipsilateral conductive hearing loss, ipsilateral akinesia of the soft palate, and ipsilateral trigeminal neuralgia. Hearing loss is secondary to compression of the eustachian tube and can temporarily be relieved by inflation of the tube. In addition, patients often present with secretory effusion of the middlea. Akinesia of the palate is secondary to involvement of the levator velae palatini. This is most noticeable when the palate is relaxed rather than contracted, as immobility is due to invasion of the muscle rather than paralysis. Neuralgia due to close proximity of the sinus of Morgagni to the foramen ovale. The mandibular nerve exits the cranium through the foramen ovale and is responsible for pain in the lower jaw, ear, and lateral side of the face. This is supported by the finding that the foramen ovale is approximately 2.5 centimeters from the sinus of Morgagni, and owing to the proximity of the sinus of Morgagni to the foramen ovale and the prevertebral fascia, infiltrates from the foramen could enter the plane around the prevertebral fascia and enter the mediastinum, theoretically. Ultimately, neuralgia, a symptom of Trotter syndrome, develops into anesthesia of the aforementioned areas. Neoplastic invasion of the sinus of Morgagni and the resulting metastasis to the skull base and lymph nodes of the carotid and retropharyngeal spaces can be visualized using various imaging techniques, including CT and MR. MR is superior to CT in identifying involvement of the sinus of Morgagni and the pharyngobasilar fascia. Visualization of these structures is important in determining the stage of nasopharyngeal cancer, as the amount of neoplastic infiltration is a more reliable prognostic factor than actual tumor volume. A comprehensive overview of the sinus of Morgagni. Invasion of the sinus of Morgagni or pharyngobasilar fascia, as determined by MR, is predictive of future distant metastasis even after radiotherapy.